Hello everybody, Dr. Adana here, and today I am here to talk to you all about our September product of the month. And do you know what that is? It's vitamin D. I know, in the summer months, you're thinking, why are you talking to me about vitamin D? And on a weekend like this where it's a bazillion degrees, even more so, why am I talking to you about vitamin D? Well, let's rewind a little bit. Vitamin D most naturally comes from the sun. However, as it's 114 right now, what are y'all doing? You're probably inside in an air-conditioned room, or if you're at the pool or something, which I spent, this weekend doing too, which was lovely, you're kind of covered up, or you're not like laying out like this for 1,000 hours, right? And the other reality of it is we all work inside. So we don't truly get the exposure that we used to have back in the day when we were outside working. So it's very important to keep our vitamin D levels at a really good place. Honestly, probably the most important reason is for immunity. And that's been a tiny bit of a hot topic the last couple of months. So if you have no idea what your vitamin D levels are, you may want to start there. A lot of times it's something typical on like blood work, like an annual physical or something like that, and sometimes it's not. So if you have a physical coming up, make sure your primary checks that off so that you're able to actually see what your vitamin D levels are. If you don't, I can send you to go get them. Dr. Chris and I work with a ton of labs in the area. And if you don't have a physical or anything coming up, let us know. We're going to put together a little bit of a list you'll see underneath of ways to go get your vitamin D levels tested, a couple different lab options, and then what to do when you actually get those results. Because on your blood work, your results go from 30 to 100. So if your D levels are already at like 31 or 32, nobody will really say anything to you and they tell you that that's normal. But that's not normal. That's actually very low normal. And ideally, I'd like to see you hanging out between 60 to 80. That's going to give you a rock solid immune system. That's going to help you with mood and brain health. That's going to help you with blood sugar. That's going to help you with bones. And older people, of course, might start to experience some things like osteoporosis. That's going to be very helpful for them. That's going to help you with heart health. That's going to help you with energy. So it's one little vitamin, but it does a ton of stuff in your body. And then on top of vitamin D, of course, I always get the question of absorption and what else should I be taking, and vitamin K and things like that. Be real with yourself. If you know you're not going to eat leafy greens, well then yes, I'm going to tell you to take cruciferous complex because it's a tiny little capsule or tablet, I forget, but it's all those vegetables that you think are gross. So if you want something like that, do it because it'll be a super easy way to get that in your system. If not, then just eat your vitamin K. It's not that difficult in that sense. So figure out what your D levels are. Let's get them tested. Let's make sure we get you on a great quality vitamin D. Cataplex D is our go-to from Standard Process for that. And then I also do have another company that we work with called Endomet that I really like their vitamin D as well. But figure out what you need, how much you need, if we get to have you on some vitamin K along with it. And let's get those levels rocking because flu season, which is really sugar season, if you're going to be more real, is coming right up. So let's make sure you are ready to go. Bye, guys.